Hello everyone, thank you for joining us today. My name is Janik Goryev and I'm the Senior Health Information Specialist with Brain Tumour Foundation of Canada, and we're really pleased to be online with you today for our 6th of 8 webinars of our 2019 webinar series. And today's presentation is entitled Transitioning Between Pediatric and Adult Settings for Brain Tumour Patients. We here at Brain Tumour Foundation of Canada really strive to provide relevant and current information on brain tumors for our brain tumor community. And 3 years ago, we launched the Brain Tumour National Conference in Toronto, and after evaluating the first 3 conferences, we found that the live streaming really had a big impact on our brain tumor population, and it reached over 1,800 people through that live streaming. So this year, we've decided to opt out of that national conference and offer this webinar series for our population across the country. And so with that in mind, just a few logistical things before we get started. If you are having a hard time hearing me or hearing the presentation, please make sure the volume is up on your computer. Everyone has been automatically muted other than myself and Mary, the presenter, so that we don't have background noise. And the webinar is being recorded, so it will be up on our website in the next couple of days. So if you know anyone who registered and couldn't sign on today, or you know other people who could benefit from this webinar down the road, it will be up on our website within the next couple of days. We will be taking questions up at the end of the webinar, so you'll see in that little GoToWebinar panel, there's a chat section or question section. You can type your questions there or your comments there, and we'll take those up at the end of the webinar. And we will do our best to get to all of the questions. If we do run out of time, Mary and I will follow up with some answers for you. And so before I do an official introduction of Mary, I would just like to do 2 poll questions to see who is online with us today. And so, oops, just one second here. There we go. And so please choose or click more than one if more than one is relevant to you. That's the word I'm looking for. So take a second to please indicate if you're a patient, if you're a caregiver, if you're a family member, a friend, a healthcare professional, or other. I'll just give everybody a second to respond. I don't see anybody responding right now. Wondering if we're having some technical difficulties here. Oops. Give me one second, everyone. It won't let people click. Okay, so we will come back to that. Oh, okay. Thank you, Todd. Sorry, everybody, just give me one second here. Okay, now can people click on these answers? No. Okay, well, let's see if the second poll works. All right. Oh, technology. Okay, how did you hear about the webinar? Are you able to click on any of these? Oh, there we go. Okay, so a little glitch with the first question. I'll maybe come back to that at the end of the webinar. Okay. Perfect. So what we have here is about 50% of you heard it through our Brain Tumour Foundation Canada communications, 6% through social media and online internet research, and then referred by healthcare professionals. That's really helpful to us, so thank you very much. I appreciate that. And we'll come back to that other poll question at the end of the presentation. So I will go ahead and introduce Mary Stuart, who is a nurse practitioner at SickKids in Toronto, Ontario, and is also appointed at Princess Margaret Cancer Centre, working in the Pediatric Late Effects Program for the last 3 years. Prior to her work at SickKids, Mary worked with adults diagnosed with cancer at South Lake Regional Health Centre. Mary is an adjunct professor at the University of Toronto and a member of the Ontario Cancer Research Ethics Board. So thank you, Mary, for joining us today, and I will hand it over to you, so to speak.
Oh, thank you very much. So thank you very much for giving me the opportunity to talk about a subject I'm passionate about, and that's helping with the transition between pediatric centers and adult centers. So my experience in transitioning people is in different populations. So people that have had a bone marrow transplant, people that have had other pediatric cancers, and then today we're talking about patients that have had a neuro-oncology diagnosis. And a lot of people think of transitions in a couple different ways. And the way I wanted to kind of think of it is just one of the many transitions that happens just like we all learned, for some of us to learn how to bike ride, first day of school, that this transition is a transition that happens at a time when a lot of other transitions happens as well, because often when people transition from pediatric centers to adult centers, they're also transitioning in school, so that it's kind of a multi-layered process of transitioning. But I'm going to start talking initially about the team that I work with, because people are not necessarily all in the Greater Toronto area, but I'll talk about the transitioning team that we have at Princess Margaret. And I'm trying to click, but it's not actually forwarding my slide. Just one moment.
If you click the mouse again on your slide, Marion, and then use the arrows, it should work. The arrows on your keyboard.
Okay. No.
Maybe click escape.
It says, beg your pardon?
Maybe click escape and then put it back into presentation mode to see if that helps.
Okay. If I give it to you, would you be able to?
No, I can't do it from my end because you're on presenter mode, but is the GoToWebinar panel closed
Oh,
off?
Here we go.
Okay, perfect.
Okay, so sorry, for whatever reason it clicked, so I'm going to keep on going. So the concept of transitioning patients has been established since about 1983, and within the past 7 years, transitioning is occurring for patients that have neuro-oncology diagnoses. Meaning that at PMH, there's a nurse practitioner, myself, who helps try to help with the transition from a pediatric center to an adult center. And really, transitioning means we're trying to look out for things, set up meaningful surveillance based on treatment. And then making sure that patients have access to information and then get the referrals they need for specialists. So the whole idea of transitioning is transitioning to a whole different team, and then the different surveillance can end up meeting meeting other specialists as a young adult. So specifically at Princess Margaret, the team is made up of radiation oncologists. There's also neuropsychology, and not every center has neuropsychology, and so they're the experts at trying to assess for learning and processing. And often patients with or without radiation, with treatment, can have a big impact in how they're able to learn and process. And to get neuropsychology testing performed in the community, it costs about $3,500. Another very helpful support that we have at Princess Margaret is access to psychology and social work support. And then access to something not everyone might have heard of is called SAVT counselors, and they're experts at trying to act as a liaison for patients when they're trying to go for their first job, when they're trying to apply for academic scholarships and bursaries. They're a wonderful liaison between patient and school settings. So then often people want to know, well, where are these transition sites set up? And so I've listed the POGO sites that have been created across Ontario. And then one of the things that most people want to know about are resources and what's available in the community, because there seems to be a different funding support system when you're a pediatric patient, and that changes quite dramatically when you age out of the pediatric community, meaning over 18. The way to try and think about transition as well is to think about what are the late effects that happen that can cause different surveillance. And some of this presentation is going to talk about late effects because what patients, what caregivers, what other healthcare providers need to be quite aware of is the importance of having a general practitioner, a healthcare provider, a nurse practitioner in the community that's able to provide the quarterbacking that's needed to make sure that patients are getting the different specialists involved that are needed, and to help provide some of the support. In a pediatric setting, a lot of the quarterbacking is provided by the teams that people were familiar with, the neuro-oncology team. In the adult world, everything is a specialty, and there's no particular quarterbacker anymore. So when I talk about these late effects and surveillance, is to try and inform people of the importance of what needs to happen and the things to look out for. And then at the end, we'll chit-chat about challenges and then questions as well. So one of the questions I wanted to ask is, of the group, what resources in the community that you're in are available to you? So some people have community centers that their family member can attend or that they attend. Are there funded organizations that have provided some help, DA programs that are accessible, or the ability to have respite care?
Awesome. So I've just got that poll up for you right now. Mary, we'll just give everybody a second to respond, and I'll read you the answers here. Okay,
perfect. Thank you.
No problem. Okay, looks like everybody's responded. And so it says 57% indicated community centers, 86% included funded organizations, 14% indicated day programs, and 43% indicated respite care.
Okay. Okay, so there are resources available, and at SickKids right now, the social work program is working on updating all the potential resources, because even though there are go-to organizations that are available, often it doesn't seem to be enough, and that's for sure very different in different communities and in different areas, but know that there are resources within our center to try and link you with more supports as well once that list is published. And I think within the next month, they'll have a list of different resources that are also available. I've also put up two that are available for people that are in certain catchment areas that sometimes people do not think about. And then we'll briefly discuss late effects, because it really does spell out transitioning needs. And I'll be super specific about why I talk about this at all. Often, once someone graduates out of SickKids, they kind of feel like if they're feeling healthy, they're not quite certain why they continue to be followed. And based on the research we've done on people that are successfully transitioned over, there is a percentage of patients that don't come for their first appointment. Because when you're feeling healthy, you don't necessarily want to waste your time if you have better things in your mind to do. And so I'm giving this as education to kind of give you information as recent as we can about why it's important to continue the follow-up. So the late effects, which impacts people that have transitioned, really are based on a multitude of factors. So patients that have radiation, chemo, and surgery are the easy things we think about. Really, where that tumor was and what that tumor was, how are you aging, do you have some healthy behaviors or behaviors that may do with some tweaking. And then sometimes your background, whether you're male or female, and the ability to have some financial success or comfort month to month impacts tremendously. So that if we look at things that we know is really something that we've learned from comparing patients, pediatric patients with cancer with their siblings. And so when you look at these life-threatening health conditions, then there's definitely a greater chance of someone that's had a pediatric cancer diagnosis of having more potential health conditions. And I mention this not to scare people, but to try and support the need for getting regular surveillance and meaningful surveillance in terms of making sure that you're the healthiest person possible, that you're getting an echo if you need a heart ultrasound, that you're getting once a year blood work to make sure that your cholesterol levels are okay. And if your memory is changing, that we're able to actually refer to try and figure out what is happening with the learning and processing. Another thing that we know is that when we compare survivors of pediatric cancer to their siblings, that they end up having these changes in their health far more regularly than their siblings, meaning that their chances of having these comorbidities are higher. And so that if you look at a survivor compared to their sibling, they end up having these conditions that can happen at an earlier age than we'd expect. So we for sure expect if we live long enough that, and if we have a lifetime of having, say, unhealthy diet, that we have a better chance of having diabetes. We totally wouldn't expect to develop lipid problems at a younger age. So I bring this up just to show you the importance of trying to have regular surveillance. But if we look at overall how patients are doing, and this is across the board with different diagnoses, really all comers in a 10-year period, there's maybe a 4% chance of mortality and a smaller chance if they're going to have a challenge that within that 4%, you'll have a chance of reoccurrence, a new cancer, heart challenges, and these other factors. So then most people think, well, is really pediatric cancer very common? When we look to the states to figure out how these most common childhood ailments happen, they see about 25,000 patients with cystic fibrosis. And you can see for cerebral palsy, heart disease, the numbers are, we'll say, smallish. But when you look about the numbers of pediatric cancer survivors, all comers, there's really 40,000 in Canada. So that even though pediatric cancer diagnoses are relatively small versus adult cancer diagnoses, there's a lot of pediatric cancer survivors in Canada. And the reason why I chit-chat about the potential risk for these comorbidities or different health conditions happening is that a lot of these health conditions are preventable. So that if you see your doctor regularly or your nurse practitioner regularly once a year to talk about exercise, to talk about diet, that you can actually prevent these comorbidities from happening when it's something that can be preventative and lifestyle changes. And then often people want to know how often do these conditions happen, like 30 years post. A lot of people that we see at Princess Margaret are, say, 10 years post, but then I follow people in their 60s now that have had a pediatric cancer diagnosis. So there's far more likelihood of developing a chronic health condition. And that based on comparison with their siblings, they're even more likely to have more than one health condition, which is why I say it's very important to have a commitment for a patient or family members to understand the commitment to having regular annual preventative sessions with their community healthcare provider. Some other research that is available, thanks to Dr. Paul Nathan and Dr. Sumit Gupta, they actually looked at the pediatric cancer survivors and the experience at SickKids, and they found that there was anxiety, there was depression in higher rates than reported in the regular population. So now that you're thinking, well, this seems quite dire, if we look overall, when they look at all comers, and this is based on 2018 reported research, really 75 to 80% of survivors tend not to experience significant mental health challenges. It's just really the remaining patients that we want to try and bring awareness because there's ways to try and have this discussed and brought up in a very supportive environment. And the importance of bringing up this discussion, because really when I was growing up for years, nobody really talked about how they felt inside. In some communities, it was felt like it was potentially a weakness and that you really had to be strong. And the focus on being supportive communities is to trying to give a voice and equal space at the table to try and help support people when they're struggling. And so part of this conversation is about what does it mean for patients that have had brain tumor specifically. So if we look at the survival rates for pediatric brain tumor patients, like they've definitely increased. There's incredible improvements in detecting, intervening, the medication, the radiation. But what is true is that there's new research that's actually reporting that there is learning and processing challenges, and we'll get into that a little bit. And there's also a lot of information to support that there's an emotional and social challenge as well that the pediatric and the young adult cancer survivor face. So that if you looked at how the processing and the memory works for these young adults, that 40 to 100% of them have a challenge in one area of learning and processing, and that really can trickle down to other things, which we'll get into. So that if you can imagine someone's in high school and their learning and processing has been somewhat impacted, then a lot of survivors can actually graduate high school, but pretend that learning and processing is impacting as a delayed consequence of treatment, then that can for sure impact employment. Sometimes it can impact school if they're in school when this happens. And when they've looked overall, all the pediatric brain tumor survivors, and they're looking at them as an older adult, when they've researched this, it tends to be that they report poorer health-related quality of life amongst all childhood cancer survivors. Now you may ask, where does that information come from? There's a lot of information from the United States, and you could argue that with the difficulty in having healthcare access and the expense of healthcare, that some of that can factor in. But really what we need to do is kind of understand this impact in the population themselves, so that we know that when someone gets cisplatin or carbo, it can for sure affect their hearing. And there's been many research, much research performed, which is actually reported that if you cannot hear, then you really aren't going to learn as much. And so when people are trying to support the use of hearing aids, you're going to get a lot of disgruntled teenagers and young adults that really don't want to wear them, because no one wants to look different, but know that there's research to support that if they can hear, they can for sure learn and improve their learning skills. The other thing that we can say with great certainty is that when someone gets a chemo and radiation, it can for sure impact learning and processing versus just getting radiation alone. And that it's not necessarily that people are declining in their IQ. It's just when they're trying to make these gains in learning and processing, it's kind of hard to make those gains over time. It's not necessarily like a dramatic decline overall. So then another thing that's important to think of, and I won't spend a lot of time, but most people, when they've had some extra fluid, it just causes pressure on the brain. And then often if it's a lot of pressure and fluid, then a device is inserted. But what is a keen thing to think about was where were things at the very beginning in terms of their location? Was it a supratentorial? Was it infratentorial? And I say that because there's emerging research that talks about just why that's important, so that we know that if someone just had extra fluid, they can also have a chance of having learning and processing problems. And initially we thought if we gave people lots of treatment, that could cause lots of challenges, but it tends to be that even the extra fluid can cause a potential challenge. We for sure know that when someone has a higher risk pathology like a medulloblastoma, that can actually impact learning and processing later on. So the other take-home message is that when you're younger, it can definitely impact your ability to learn and process. So the tumor size can make it challenging to get to the higher IQ, and that the higher risk pathology like the medulloblastoma is associated with a harder time in learning and processing. And that definitely the location can cause challenges. So when I was pointing out to the infratentorial tumors, they seem to have a bigger impact than people that have the supratentorial tumors. So location matters. And then when patients undergo, some of you may be familiar with posterior fossa syndrome, that's with the challenge with speech, walking, you kind of have behavioral challenges, that also seems to disrupt the pathways. And when you look at the brain and then the pathways, you can see why that would be a problem. So then what are some other factors that we know to be true? It seemed like some other factors that we know to be true are what really makes us an adult. So there's been lots of different psychoeducational models that kind of describe the different age groups that people obtain. So some people think becoming an adult means that you're able to have a family. Some people think it means you're having your job. And they're all transitions that they would expect most adults to have. Some people think it's by being a part of a big group. So if you were to ask whatever the available literature is today, most people would say that perhaps that happens between 18 and 25, although that would be really within industrial societies. In other societies where everyone's working and not going to school, that would not really matter. As soon as you're able to work, then you're an adult. But when we're actually living in Canada and we're trying to figure out what are those adult milestones and transition milestones, and often people think about it as, are you able to be economically self-sufficient? Are you able to have a relationship? And are you able to hold down a job? And then there's some challenges with that, those different thoughts and milestones. So sometimes some patients are not able to become independent, and so they're still at home despite the age. And sometimes some patients are not able to have these milestones. They're not dating. They might not have the same peer group after they get out of high school. And then some people are just not able to live alone. So if their vision is challenged, their walking around is challenged, then there's a shortage of assisted living places and then huge wait lists to get in them. And then what does that mean to the family? So if your family, in your mind, you were thinking everyone would be transitioning out of the nest at age 18, at age 25, at age 30, and then that's not happening, then that changes what happens to the family. Emotionally it impacts, financially it impacts, and then parents get older. As much as we don't want to, we get older. So then if we look at the research that's available on survivors of pediatric brain tumors, it's likely that the survivors are going to feel different. They're not in those relationships. They don't have the job. They're not able to hold down the job. They've had one. They're not in that job. And they notice their siblings doing fantastic things. There's other things that are associated with being things that cause anxiety and depression. Often it's poor physical health, having more than one health condition, or if they look a bit different after they've been radiated. They're not as tall, they don't have as much hair. Other things that we know to be a challenge for people that are transitioning in young adulthood is that often, if you're not able to learn and process with the same ability and it changes over time, it's very hard to kind of have enough income to be on your own. Or if you are on your own, then it can sometimes be a bit of a struggle. And if people are in jobs and they're not able to keep in those jobs because of processing changes, then it also becomes a challenge. So I would say that other patients have challenge with access. So if they don't have access to different supports, if there's not as much income, if they haven't had a lot of support going through school or through college, then it tends to be patients that are with less money, less education, not as much access to different outings and socialization, and then there can be even more risk things that happen. So they've taken a look at the population in the States, and there seems to be more risk for high-risk behaviors like alcohol, smoking, physical inactivity or activity. So the whole point of bringing up the point of anxiety and depression is that there is a means of trying to help and support patients, and that support can happen at any age. And the idea would be having a healthcare provider coming for annual visit in a late effects clinic. We actually have the expertise to be able to talk about things that are uncomfortable, and we normally are able to do it most efficiently and most effectively with parents out of the room. meaning that if a young adult has their parents there, they're going to answer very differently questions to try and not stress out people they love. So one thing is giving patients access to talk about how they feel. And the other thing that's super important is trying to have a network for socializing and social skill skill development, and to not try to feel separated from peers no matter where you live. So then what do they know is really helpful is to give people access to cognitive behavioral therapy, which is something that can be offered by social work and health psychology. That social skills training is very important, and that really educational opportunities really need to be enhanced early to try and give people as many options as possible. The other thing that is a take-home message that's super important is exercise and diet, because we know that a healthy body and a healthy diet can give us less chance of developing comorbidities from inactivity and poor diet. So then most people want to know, like, what should I really focus on? What is important for me to do? And what would be the best steps to do? So the one thing that I recommend is to advocate for skills training across the board, so that if we know that it's helpful to offer skills training, not just when you're in high school, that it's important to have the opportunity to skill build when you're a young adult and older adult, then that's where we should try and focus to give people a chance to skill build with whatever their processing abilities are in a supportive environment. And then we really, really need to continue to research outcomes for patients in transition. We have emerging research and information on what is helpful to know from a psychosocial perspective in terms of mood and affect, but there's other important things that we should look at as well, like what is the best way to help young adults skill build, older adults skill build, what is the best way to socialize, how can we best support mobility? If someone has been with a difficulty walking forever, like what makes the most sense for activity? Like, should we be doing yoga, sitting in a chair to try and help people strengthen and skill build in terms of their physical body? So more research has to be done. I also think that there needs to be an opportunity for support for parents and family members, because it's not just one person that ends up feeling stressed and anxious. It tends to be whole families. And I'm not quite sure if in 2019 we're able to support family members to the best ability needed. But I'd be very interested to hear what people that are listening think about that as well. I just know that all the research out there says that if a family member is stressed, it for sure impacts on the other adults in the family, and that the stress does not diminish over time. In terms of the rest of the conversation, I wanted to let the group try and have an opportunity to offer information and questions, because really what I wanted you to be able to take home from this is the idea of the importance of having a good healthcare provider within your family that's able to try and assess what makes sense for follow-up, and then make sure that you're confident that you're getting the information you need at your follow-up visits, so that there's specific guidelines that we follow that's research-based when we're trying to look after patients that have had chemo and radiation at different ages, so that know that there's knowledge, it's research-based and accessible. And if you're worried that your healthcare provider does not have access to information that's helpful, then it's also a good time to try and check in. I know at PMH, and it's not available everywhere, there's an ability for a patient to get online and get access to their clinic letters, and it spells out their the effects and the important information they need for transitioning. So a lot of adults don't necessarily continue to live in one area, they actually go to other areas. So it's an idea of making sure that people feel that they have enough information to go where they're going, and to understand what it means in terms of their own personal follow-up or their family members' follow-up. So I'm wondering if we are able to go to questions.
Hi, Mary. Yeah, we can totally go to questions. Oh, only one has come up at this point, but I will read it to you. It's from Sarah, and her question is, what sort of social policy changes would you like to see in order to assist survivors of childhood brain tumor diagnoses with life skills, income, etc.?
I think the biggest, I think something that I'm fired up about personally, that would probably have the best impact is trying to have more adults have access to either a shared living environment or independent living environment depending on their needs. And I'll give you an example. In Toronto, I think there's Rena's house, and there's 7 slots available in the building for assisted living, meaning you could have your own apartment, but you're able to kind of share an environment with other people that can kind of pop in and make sure things are going okay. If we truly want to have adults transition, part of that means being able to operate independently, and I'm not quite sure if you can operate independently if you're still at home. I do think there's a benefit to having people living in a safe environment that's a shared cared environment as well. And the only way I know of to do that presently, which sounds kind of like a disconnect in an idea, is to try and envision a senior citizens home, having it shared cared with young adults, so that there's this ability to have all those resources, all the different things that are offered, and the idea of independent living, but in a social environment. I know in different parts of the world, they actually have that set up. So they have young people and older people living in one shared area, and there's benefit for both. So if you were to ask what would be the biggest way to try and target helping people is, number one, having more access to mental health resources. The initial government, I think before Ford, had promised that there would be an inundation of money so that when people went to see a health psychologist, it would be covered under OHIP. That never happened, and a lot of people cannot afford $200 or $250 a session to speak with a psychologist. And what that means is that they can have access to someone, but if you can't pay, it's not really access. So that I think one thing that actually would help is if that was funded. So social workers, health psychologist is absolutely not covered. When you come to the hospital and you're in a late effects program, they'll actually see you without charging. But in other communities, it can be kind of cost prohibitive. So there's some programs that will see you for free if you're less than 26 years of age, and it might be every time it's like a drop-in visit, but it's not necessarily sustained meeting the same person over time. And so I really do think that there should be a movement to give people independent or shared living opportunities. And then for sure, based on research, there should be access for everyone to be able to have health psychology access. Because if you were to ask, like, how long would it take for someone to work on something as important as anxiety? Anxiety is lifelong. Sometimes people can have situational depression, but if there is depression, that's also something that's ongoing. And so often people need about 8 visits to try and skill build so that they feel that they can do some things on their own so they're not feeling the same. The other thing is to try and advocate for a voice for having changes in how you feel and making it a safe place to talk about. Not all backgrounds of people actually have the same idea about mental health. In some families, it's not discussed. Other families will actually focus on the fact that we actually can provide you things, so you really shouldn't worry about how you're thinking. And so that's what I'm saying. It's diverse because we are diverse. And so one thing we can do is unify and say that we will support people having access if they need access, and that families can actually feel like they're supported.
Great question and great response. Thank you so much, Mary. There's no other questions that have popped up yet, so just while give maybe everybody another minute or so, I just want to try to launch that original poll that I tried to do at the beginning. So let's see if it works this time. Who is currently online with us? Click as many that apply. Oh, it's working. Yay. Are you a patient, survivor, caregiver, family member, friend, healthcare professional, or other? Perfect. And so just as an FYI, Mary, 38% of the audience today were caregivers, 23% were family members with friends, 31% were healthcare professionals, and then 22% were other. The other is probably some of my colleagues who are listening into the presentation as well. And so there aren't any other questions. Is there anything else you wanted to add, Mary, before I talk about some programs coming up?
The only other thing that I would mention is that there is the ability through Camp Ooch. They're actually hosting adult survivor weekends, so that if people were to go onto the website, know that there's that opportunity. And there's also launching, I think, September 24th. It's Survivorship Cancer Canada. And they're also trying to develop a network for families and survivors.
That's great. Could you send me those
so
details?
Know that those things are available. Beg your pardon?
Could you send those details to me? And we
for sure I can. For sure I can.
Our community, that's awesome. I'm going to switch you off as presenter for a second so I can show the audience just a couple things on our website, so don't panic. I'm going to show everybody my screen now. So just as we have everybody on here, our next webinar is going to be on October 9th, and that's going to be with Dr. Dr. Faith Davis. And you can find information on our website here when you click the webinar series. And this is the exact same page where everybody will find the recorded webinars. So in the next couple of days, we will get Mary's presentation up on this section of our website. So if you scroll down, this is where it will be. And then also Dr. Faith Davis's presentation on Brain Tumour Registry of Canada, past, present, and future, will be on Wednesday, October 9th. That's one of our programs coming up. Secondly, on October 18th, Friday, October 18th, we're going to be doing a celebration dinner here in London, Ontario. So you can find that information here on our webpage. And this is an opportunity for us to honor some of our volunteers. We'll be giving out some awards that night, our Volunteer of Distinction Award, the David Kelly Award, as well as the Cup of Hope. And it's a really great dinner. Dr. Faith Davis will also be here giving a presentation, and then we have a nice dance party at the end. So come on out to that. If you're in London or area, the tickets are only $25 to attend the celebration dinner. And then third, we have on October 24th is our second annual Brain Cancer Awareness Day. And what we're doing this year, again, is a campaign called Hats for Hope. And so what we're encouraging people to do with this nationwide brain tumor awareness campaign is to provide hope for those affected. And by doing so, what you can do, I should say, is wear a hat. It doesn't have to be this gray hat on the screen, but you can wear a hat, take a selfie, and then or a group photo and share it on social media using hashtag Hats for Hope and tagging Brain Tumour Foundation of Canada. If you would like to purchase one of these awesome toques, you can do so on this page as well. They're around $30, give or take. And we're really excited to be doing this campaign again. And Canadian Olympic ice dancer Piper Gillis will also be at that celebration dinner with us on Friday, October 18th. And then another event that we're doing here in London is a research symposium, and that is happening on Saturday, October 26th. So for anybody in the area, this is a free event to attend. It's a really cool event in that undergraduate students from a variety of different programs are given a case study ahead of time, and they present in front of a panel of physicians and researchers, and they get feedback on their suggestions, on their research, and so on and so forth. So it's just a really cool, fun, free event happening on Saturday, October 26th here in London, Ontario. And then for those of you who are here, online right now and are caregivers, we are working on a brand new handbook. It'll be called the Caregiver Brain Tumor Handbook, and we will be launching that in October. So that will be another free resource. Our blue handbooks are a wealth of information, but there's no really information for caregivers, and so we really wanted to create something special for you and specific and unique to our brain tumor population. So stay tuned for that. That will be available for free as well. And we do have another question that came up here, Mary. It says, do you know of any resources specifically in Vancouver, BC that you might be able to refer to?
You know what? I know a couple of SickKids staff doctors that are out there.
Okay.
I can try and find out. And did they say exactly what the resources were, or just any resources?
No, April, if you're still online, maybe you can just type, let me know if there's any specific resources you're looking into, but we can definitely get you connected with some people out west.
Yeah, there's 2 doctors that work out there, so no problem. I can find that out.
She says any resources would be great. And then the other question was, do you know if Camp Ooch is also available for people with non-malignant brain tumors, or is it just malignant? You know anything about that?
Meaning like an astrocytoma or something?
Yeah, like low-grade. Would they accept people like with low-grade brain tumors, or is it just?
Yeah, so anyone that gets follow-up at SickKids or PMH generally can go on to go to Camp Ooch. So that some people have these things that are treated, even though they're not like an aggressive tumor. And so I say that because often people are told you do not have a tumor, and you come over here and I talk about, well, you've had this treatment, and they're like, yeah, but I don't have a cancer. And it's true, because it's not like an aggressive, fast-growing lesion, but it does not mean that you can't qualify for scholarship support. It does not mean you cannot try and go to Ooch as well. So that it'd be unlikely that you would get rejected if you had been seen at SickKids or Princess Margaret.
Great. Okay, awesome. Thank you. I think that's it. That was a great presentation. Thank you so much, Mary, for taking time out of your busy schedule to join us today. And as I mentioned to everybody earlier, we will have this website up on our, the webinar up on our website in the next couple of days. And keep an eye out for that new caregiver resource. And please join us at those events here in London, Ontario, if you're able to make it, and or sign up for the next webinar. Thank you.
All right, thanks.
Okay,
have
bye,
a great
everyone.
afternoon.